I wanted to talk a little bit about abdominal contour, specifically etching and techniques where we're using liposuction. Sometimes we're using energy-based devices like Vaser to try to create additional definition. And that's done for a couple different ways. Number one, a tummy tuck generally makes that abdominal flap, that layer of skin and fat above your abdominal wall muscles, thinner and tighter because we're pulling that down and it stretches it out a little bit. But we're also employing liposuction techniques to make that also a little bit thinner. Etching takes it one step above that. We're actually carving out and making uneven thicknesses of that abdominal wall flap to try to either reveal some of that abdominal wall muscle or to simulate it. And that's the key difference. In my opinion, in my hands, simulating or aggressive simulation of some of that contour doesn't make a ton of sense. And the reason why is because over time, it tends to look very artificial and very fake. And so in my hands, what we really try to do is we try to minimize kind of the fake etching, but really emphasize what you kind of already have out there. And there's a lot of techniques to do it, but it's a really, really hot trend. And so I wanted to give you a little bit of insight in some of the differences. Again, in our practice, fake usually doesn't have a wonderful long-term overall concept, especially when it comes to liposuction. We really want to reveal those contours that are present underneath you. So.